Good morning and welcome to Global Healthcast, brought to you by Global Health Press. I am Joe Schmitt, and with me today is Dr. Melvin Sanicas. Good morning, Melvin.
Good morning, Professor Schmidt, and good morning, good afternoon, and good evening, everyone who is watching us wherever you are at the moment.
We have great topics today. After the COVID-19 uptake, Melvin will present post-COVID information risk factors from the United Kingdom. I will talk a little bit about pertussis vaccination during pregnancy. There will be, there is already a new name for monkeypox. We will talk about dengue and dengue vaccination, and we will have some information on increased risk of endemic mosquito-borne diseases due to climate change. Largely, and in the end, I will discuss RSV efficacy of maternal vaccination data that was just released on a new vaccine against RSV. Melvin, let's start with the COVID-19 update. What is the news?
Yes, so for those of you who have been watching us, you already know that we start with a quick COVID epidemiology update. And this is something that we get from the WHO COVID situation report, and this is not real time. This is a week late. But here you will see that the new weekly cases, the number of weekly cases remained stable, and the number of deaths actually decreased if you compare it to the previous week. So this is what you see for the number of cases and deaths worldwide. And if you compare it to the previous years, we are definitely in a much better place.
Very interesting. So are case numbers declining everywhere on the globe, or are there local differences?
There are specific countries that have reported increased cases like Japan, France, and China. But the rest of the world basically report decreased number of cases and deaths.
For China, it is not unexpected as they are reopening, and I guess that's what happens then. For Japan, I'm not sure. I cannot interpret the data. I just wonder for France, do they do more testing, or I'm not sure. Do you think it is real, or do you have any information?
Well, it's probably not because of testing, because they're not testing much more now compared to previous weeks. It's probably because of the variants.
Yeah. Anyway, we'll keep you posted on this. I think this is interesting. If something fades out, there is a lot of information that is new and to learn on the disease and on the virus. So I think the disease is much milder now, and we may have the same number of infections or even a higher number, but it is not detected because we don't test if the disease is not severe enough, I guess. But I have no idea. We'll follow up on this. And Melvin, you have risk factors for long COVID. What is the story here?
Yeah, so this study was conducted to really look at the burden and predictors of post-COVID-19 syndrome or long COVID in a local population in East England in the United Kingdom. So what the investigators did was to send survey to patients who had confirmed COVID-19 infection by PCR in 2020. And what they have seen in the study was that male sex was negatively associated with the use of further health services, so meaning hospitalization and other things that related to COVID. Whereas BMI, or the body mass index, was positively associated with the further use of health services related to COVID. And this survey of a quite large number of people previously diagnosed with COVID shows a high prevalence of self-reported post-COVID-19 syndrome. And it's the female sex and BMI that were associated with an increased risk of long COVID and further use of healthcare.
Interesting. So female sex or male sex, you cannot change, right? This is a given. You cannot change the risk here. But BMI, you can. And I guess the message then is lose weight, right? But this is quite difficult. Many people have a hard time losing a lot of kilos that they are overweight. So yeah, it is always good to lose some weight, but it's difficult.
Yep.
Melvin, for these, for no other, I guess they looked for more risk factors, but did they find anything else, or was this
No,
the only positive finding?
yes, these were the only two that were significant.
Yeah, and the other question then would be, following mild disease, the incidence of long and post-COVID is still the same, or does this change? Is it only seen? Look, I mean, everybody has now this mild infection, right? Most people have had COVID. So here in our climate zones. So the question is the risk still the same, or is this declining with the decline of the disease as well?
Well, there is a different study, not this one, that showed that those who had a more serious COVID disease had higher risk of getting long COVID. Although it also showed that those who had mild COVID, it doesn't mean that you don't get long COVID symptoms.
Okay. So you can get it independent of disease severity, but with more severe disease, you have a higher likelihood.
Yep.
Okay. Very good. I learned something. I'm covering now pertussis, and particularly pertussis immunization during pregnancy. It is recommended, I guess, in each country that has specific recommendations for pertussis prevention in the newborn. Everybody can get pertussis, and the reservoir is the adult, but it is the very young children in the first 3-6 months who die and have severe pertussis. So this is what you prevent. You want to prevent the disease in the very young. And you do this by vaccinating pregnant mothers. When should you vaccinate? And very clearly, the efficacy to prevent infant pertussis is highest if you vaccinate in the third trimester, 77.7% effectiveness versus 50% before pregnancy. And if you vaccinate after pregnancy, it is very low. This is only the effect of cocooning. The mother won't get pertussis, so the child is protected, but the child has no antibodies. The child has no immunity against the disease. And this is why the best thing you can do is vaccinate late in pregnancy. And this is the recommendations, and I took the CDC recommendations because they're easily accessible for everybody. They recommend vaccination at 27 to 36 weeks gestation, and they recommend Tdap during every pregnancy. And postpartum administration is not optimal. Tdap should be given to close contact siblings, grandparents, and other caregivers. It's always good to protect the environment of the newborn so that it will not be exposed to any organisms. And this is working, that has been shown. But the most effective thing, I mean, 77% effectiveness for pertussis prevention is really vaccinating the mother with Tdap late during pregnancy. And finally, Tdap should not be offered as part of routine preconception care. But if you did it, you still should re-administer the vaccine during late pregnancy. So this is the important recommendation. Now, the problem is Tdap is a combination with vaccine, and it has antigens against tetanus, diphtheria, and pertussis. And the only thing that you really need is the pertussis component. No company until very recently had an acellular pertussis monovaccine. And this is now available from Thailand. And I missed this paper, I have to admit. This is published already in 2017. And what you see nicely here, this is a genetic recombinant technology, genetic acellular pertussis vaccine with two components, PT and FHA. And you see the nice titers here. If you get AP mono, you get these beautiful titers. If you get the recombinant combination Tdap, you get lower titers. And if you use conventional Tdap, you get nice titers to begin with, but they are much lower. And this is the titers again for PT. This is the titers for FHA. And for the PT, you can also use a neutralization assay. And look here how nice the titers are with the AP. And here for the Tdap, that is recombinant technology, and this is conventional technology. Very nice data. I understand from colleagues that I met from Thailand, they tell me that the vaccine is licensed in Thailand. And we're looking into this a little bit because maternal immunization really becomes something very important now around the globe. And we'll talk about that later again when we come to RSV. But this is really, really good news for a pregnant woman, because high titers means if you have them in the mother, they will be transferred actively to the newborn, and that is how the newborn then will be protected early in life. Melvin, any comments, questions, views?
I'm just curious, what happens if you give the vaccine again after giving it before conception? What if you give it on the third trimester? Is there any adverse events or more issues or whatever for the mom?
Before pregnancy, again, as shown here, the efficacy is 50% because there is some transfer of antibodies, right? But here you get 25% more protection. The safety is roughly the same. There is no difference, no relevant difference, and there is no safety concern. There's a nice review paper from several authors out there. So there is no safety concern. The only issue is if you give Tdap repeatedly, you have a high level of reactogenicity because the T and D are not needed. You give too much. And again, there is no safety concern, but it's not needed, right? And the Tdap has this disadvantage. And now with a monocomponent AP vaccine, acellular pertussis vaccine, this is really great. You give what you need, and that is the AP.
So it's reactogenicity and I guess maybe cost. Okay.
Yeah, although I have to say over here, Tdap is a quite cheap vaccine. I'm not sure about developing countries. It may still be too expensive. But with this vaccine coming from Thailand, and again, I have to investigate this further, what the uses are, what the license looks like. I just picked up the paper that I received, and I think this is really nice. Yeah.
Okay.
Very good. I think, Melvin, you have a new piece of information on monkeypox.
Yes. So this is, this is really just showing that after a series of consultation with different experts, WHO announced the start of the use of a new preferred term, Mpox, MPOX, as a synonym for monkeypox. Both names will be used simultaneously for 1 year, while monkeypox will be phased out. And the reason why they did this is because when the outbreak of monkeypox expanded earlier this year, racist and stigmatizing language online and in other settings were reported, and in several meetings, public and private, a number of individuals and countries raised concerns and asked WHO to propose a way forward to change the name of monkeypox.
I think it's getting ridiculous. Look, the term monkeypox has been used since decades, and all books and all past information is monkeypox. And now they changed the name for no good reason, because monkeys won't worry if you call the disease monkeypox. They won't even know that we call it monkeypox. I don't see any racist language here if you give it the name that has been used over decades. I think this is going too far. But maybe we live in these times and we have to live with it, and we have to accept it. But I think this is stupid. This is a waste of time and energy.
For me, I think there are other things that are more important than changing the name of monkeypox to Mpox.
Yeah. Look, why do they? If you have a meeting for 1 hour with one scientist, and the hourly rate of a scientist, let's say, is $200 per hour, you have 10 of them around, and this is 2,000, right? Roughly, besides all other items and the indirect costs, and so this is wasting money. This is wasting the time of researchers on important things. And I don't get it anymore. Anyway, we cannot change it. Yeah. Besides monkeypox, I think dengue is next on our topic, and you have some news from Bangladesh.
Yes. So this is from Bangladesh, as what you've mentioned. So the high incidence of dengue cases this year is basically taking place in the context of an unusual amount of rainfall in the country since June 2022. And this is accompanied by high temperatures and high humidity, which have really resulted in an increased mosquito population throughout Bangladesh. And as you can see here, you see a significant increase of the number of cases and, of course, deaths in the country.
Very interesting. So rain is a confounder for dengue, right? You might even think that it looks as if rain is the cause of dengue, but it isn't. It is the mosquito that can breed better when there's high humidity, right?
Yep, with a lot of water around, mosquitoes can breed, and then they can increase their population, and they can reach more people, basically.
Yeah. So I get more and more convinced that climate change really results in infectious diseases, in more and different types of infectious diseases, right? Mm-hmm. Very interesting. Yeah. And dengue has also been around in European countries, right? There have been cases, not only imported, but autonomous cases, right?
Yeah, reported in Italy, in Spain, Greece, basically the countries that are sort of in the lower region of Europe.
Yeah. Interesting. So dengue will keep us busy, I guess, in the next months to come, also because there is a vaccine against dengue that received a positive opinion by EMA, by the European Medicines Agency. You can see that here. I'm not sure when the license will be finally out and the EPAR, the European Public Assessment Report with the label and all the detailed information. But this is only a question of a very short time until the positive opinion results in a signature, and then the vaccine will be out there in pharmacies. So I'm really looking forward to this. And any views from your side or any comments?
Well, I think this is good news that we have this new vaccine that does not need testing before giving the vaccine to see whether the person has been infected in the past with dengue or not.
Yeah, that what you mentioned is the Sanofi vaccine that is licensed already, and that is only recommended to be used after or in subjects who are seropositive against dengue, right? Mm-hmm. Yeah, but again, mosquitoes like humidity, and mosquitoes are spreading to the more temperate climates, which get hotter and more humid, and we're having a different climate. And I guess that covers already your next piece here, mosquito-borne diseases and climate change.
Yes, so this is not really a new study, but I chose this because I want to emphasize that mosquitoes are not only public health problems in the tropics or in countries with warmer climate. This is from Canada, and this is a publication from before COVID, actually, in 2019. In Canada, there are currently over 80 species of mosquito endemic in the country, although only a few of them carry pathogens that can cause diseases in humans. So we have West Nile virus, Eastern equine encephalitis virus, and the California serotype viruses. And as you can see here on the first column, you will see that increased temperature and increased variability in precipitation will cause increased mosquito range and density, so they can breed more and they can reach more places. And it also causes increased changes in host range and density. And then because of that, you will expect more epidemics caused by all these different viruses here. And this is expected to happen not only in rural areas, but also in urban areas. And on the last column, you will see here how to manage. Of course, it's a lot of things that you can do, right? Starts with awareness, prevention of exposure to these mosquitoes, and diagnosing and basically providing supportive care for patients who have been infected. And for me, it's really all these things are important, awareness and making sure that the climate crisis does not worsen, because at the moment all these different mosquito-borne diseases caused by viruses don't really have treatments, right? You just provide supportive care for people who are infected.
Yeah.
And so these expected climate-induced changes in mosquitoes and mosquito-borne diseases really emphasize the need for continued surveillance and research to really make sure that we have accurate evaluation of the risks to public health.
As you lived in Singapore, I remember in Singapore, they check for breeding options for mosquitoes in your household, right?
Yes.
They have mosquito control measures.
Very strict about that. So regularly people from the Environment Bureau go to your houses and see whether you have all these different pots or other containers lying with water and with mosquitoes breeding in them.
So mosquito control is one of the assess, monitor, risk items that is listed here, right?
Yeah. Mm-hmm.
Very interesting. Yeah. Yeah, we will hear more about mosquito-borne diseases in 2023, I'm sure. Lastly, I am covering RSV, respiratory syncytial virus. If you are 2 years old, you've had RSV, and usually 50% of those age 2 have had it twice. And in the temperate climates, we see epidemics every winter. In the equatorial zones, in the warmer climates, we see RSV happening and infecting people throughout the year at a more or less constant level. This is WHO data saying that of all pneumonias, 31% are caused by RSV. There are 33 million acute respiratory infections a year, 3.1 million hospitalizations, and 118,000 deaths. I think this is a huge underestimate, at least the numbers that are here on the left top corner. I think these last 3 numbers, this is too less. It must be much more. There is a huge financial implication. I don't go into this. The important information for me was here, more than 99% of deaths due to RSV occur in low and middle income countries. This is really a shame, and this needs to be changed. And the way to change it is certainly vaccination. And by the way, of the deaths, 20 to 50% die in hospital and 50 to 80% outside the hospital, and this is the average age. So the information from the slide, it's low middle income countries with the highest burden of disease when it comes to death, and it is the very young who die. And I could add to this even, particularly if they are premature. So prematurity is a real risk factor for severe RSV and for dying from RSV. Now, until 2013, there were several attempts to come up with an RSV vaccine, and none of them worked because the antigen, the relevant antigen that induces protection and produces the right antibodies is the F protein. And that has 2 conformations, pre-fusion and post-fusion. And you only get protection if you have the pre-fusion antigen of the RSV. Now, with this knowledge available since 2013, more than 2-3 dozens of companies came up with RSV vaccines. And these are phase 3 vaccine trials that I've listed here from the literature, and some of them have finished. And I'm showing this here today because there are now, for the first time, data on maternal vaccination during pregnancy and protection of the child. And this is summarized in this slide from press releases from Pfizer. And what you see here, this is the older adult study, 66 and 85% protection rate, but the Matisse study showed that prevention of severe medically attended RSV, lower respiratory tract infection, up to day 90, protection rate is 81.8%, and up to day 180, it's 69.4%. So this is really good news. Maternal immunization does work. The question now is, How do you get it to those countries that are in need, where most children are dying? And again, that would be low and middle income countries around the globe. Melvin, any views on maternal immunization against RSV or comments?
Well, I think this is good news. And I just hope that these vaccines will be made available to developing countries because, as you've mentioned, the burden is really there.
Yeah, and many of these low middle income countries, they have an excellent setup for maternal immunization. They basically, very few countries are left that still have maternal and neonatal tetanus. So the programs out there is really, really very effective. And the only little thing now is to add RSV to this. And the next step then would be to also have a combination vaccine, right? Added to acellular pertussis or whatever, right? So that mothers don't receive 4 vaccines in the last trimester of their pregnancy, which would be probably influenza, RSV, COVID, and Tdap, right? So it's 4 shots by now, right?
Yep.
Very good. I think this brings us to a close for today. The COVID update is numbers are declining with the exception of a few countries. High body mass index and female sex are risk factors for long COVID. Pertussis vaccination during pregnancy. There is an AP monovaccine out there in Thailand, which I missed since 2017, but it's apparently licensed even. There is a new name for monkeypox. I'm not sure if this is of any help for anybody. The disease is still the same. There is a dengue virus outbreak in Bangladesh, and that has to do with the rainfalls that happened there and the flooding, and that resulted in more dengue cases and dengue deaths. There is a vaccine that received a positive opinion and that requires no testing before vaccination. There is an increased risk of endemic mosquito-borne diseases due to climate change, as the example of Canada showed us. And finally, there is data now that maternal vaccination against RSV using a pre-fusion F protein antigen is efficacious in preventing RSV in the very young. Melvin, you have a nice cartoon in the end.
Yes, so I think this is pretty self-explanatory, basically just showing us who actually led the digital transformation in your company. And I'm sure the CEO and the CTO, the Chief Technology Officer, tried to do this years before COVID, and there's always a lot of pushback that this cannot be done because of so-and-so reason. And then COVID-19 came and everyone stayed at home and used Zoom or Microsoft Teams or whatever. So... Yeah.
I was flying to New York to my team members once a month before COVID, and COVID came and there was no single flight to New York, right? So COVID changed the situation, right? And I think this is absolutely right. This really hits the point. So thanks for sharing this, Melvin.
Yep.
This is the end of our Global Health Cast 22 today. I'm happy to have you here and hope to see you again a week from today. Goodbye.
Thank you, everyone.